pretty good.
That's pretty good. You only need half for your size. Right? You don't need the whole big one, just half of them. I don't want my belly showing to the road. It's too big, and I don't think I'm ready for that. Hey, this is the same as my speaker. Pretty similar. Usually I'll tag show. Not today. I usually gotta find him. Okay. Whatever. Okay, we won't do that. It takes off the. A year? 14 months. Yeah. Really? All right. Well, we're not going to do that on camera. No, baby. It'll be interesting. Well, I'll go walk with them. Yes. New jewelry.
It's a good piece of jewelry there.
Piece of jewelry.
Yeah, that's a nice tool. So here we're going to get started. So today we're doing abdominal pain. And we're going to take a look at the muscles that cause pain in the abdominal region. So the most likely one, and you'll see the second most likely, we'll get started on that in just a minute. But why don't you go ahead and tell me where you're coming in from, and tell me what's going on with you and where you are. Now you can see we're in downtown Chicago, in the mountains of Chicago here, right by the water tower. And this is the pain-free and full function clinic in the water tower at 976 W on the 9th floor of the water tower. Okay, so today we're going to treat the muscles that cause pain in the abdominal area. So let's take a look at that. Yeah. Hi.
Hey everybody. So Sharon, why don't we take a look at the muscle?
Yes,
and then
let's
we'll
do
look
it.
at referred pain.
Yeah, we're going to do it.
Yeah, and then maybe the range of motion test for that muscle.
Yeah, why don't we do that? We'll do it that way
We'll do
today.
it this
That's
way,
fun.
I thought. It's a
I think
cool
that's
way
a
of
good
doing
way.
it.
That's a good way to do it today.
All right.
So today we're going to be thinking about our rectus abdominis because that's the most likely one to cause low abdominal pain.
Yeah.
And causes back pain.
Well, that's the thing is these abdominal muscles you're going to work on today, they cause pain in other areas too.
They do. They cause all kinds of problems, you know. And it's amazing. It's been so the people who come in with the problems with the rectus abdominis and the obliques and the all the abdominals, the transverse, they really could have some terrifically bad problems that can be corrected just by treating the abdominals and making them longer, make them functional, and not cause their referred pain patterns.
Why do you think people sometimes avoid the abdomen? It just seems like massage therapists go for a full-hour Swedish massage. There's no abdomen involved in there. Why does it seem like bodyworkers avoid the abdomen?
Can we understand that?
Maybe it's because there's organs in there, and they feel
there's
they
things
feel a
that
little
they might not
concerned
want
or
to
something.
touch, maybe, or something.
Yeah.
Yeah. Well, okay,
you're gonna lose that fear today.
hopefully.
Yeah.
So if you have that one, we can get rid of that because
Yeah.
we need to treat the abdominals.
Yeah.
And sometimes we need to treat the fascia and the organs. You know, one thing that Travell would say, she would often say how the viscera can activate all the abdominal muscles,
Oh yeah.
and how the abdominal muscles can activate the viscera.
Oh yeah.
So that could be really important to keep in mind that they could work with each other and cause trouble. You know,
That's
so
right.
yeah. So how about if someone comes in, they draw on their page that they have really bad pain in the abdominals here. So
Yeah.
what if it was over here on the right?
Yeah, yeah.
Okay, so then we'd be thinking, well, oh, they have pain right here in the abdominal area on the right. And then you think, well, what muscles cause that? So then we go to our chart, right?
Yep.
So then here we go to the Rosetta Stone of the myofascial field, and we find area 17.
Yeah.
So let's see if we go ahead and find that for us.
There's number 17.
Mm-hmm. You see it there?
And here
You
it
go
is.
find it right there.
Oops. Abdominal pain.
Then you go, oh, the most likely one to cause it is the one on the top.
Rectus abdominis.
Yeah, the second most likely is what?
The obliques.
And the third most likely.
They, you guys know that Chinese hand torture device or trick where you stick your finger in.
And then it squeezes
yeah,
it. You put it in. Woo!
Put a
it
finger in on
squeezes
both sides, and they try and pull it apart, and you can't get your finger out.
You can't.
Yeah. That's there. You have a muscle in your abdomen like that, like a corset or whatever they call it. It just wraps around the abdomen and squeezes it in like a transversus abdominis. That one.
Mm-hmm. So let's take a look at the first one.
Yeah.
And so since the person said that they had pain on the right side.
Yeah.
And so let's look at rectus abdominis, and why don't we go ahead and look at it in Travell's book to see if there's anything interesting that we might want to point out. So here's our rectus abdominis here, and let's take a look at the referred pain pattern. You can see here's your rectus abdominis right here. And it causes its classic pain in the back here, especially the upper section causing it here, and the lower, just above the pubis, causing it here. So is that interesting how this muscle in the front? In fact, can I tell you something what happened?
You guys are saying it's blurry for you?
Oh, it's blurry.
Let's try and clean it.
Let's clean it off a little bit. What do you think
Is that
now?
better?
What, do you want to see if you can make it tap on it?
It's facing me now. You guys like, does this look less blurry? It's pixelated.
Oh no. Oh, is it off the?
It's off the Wi-Fi.
Okay,
Make
good.
sure.
Okay.
Yes, better? Huh? Better? Okay, we switched back to this camera. Looking fine there? Okay. Anybody less blurry? Okay. All right, I think we're okay.
Okay, good.
All right, good. So the rectus abdominis has this unique pain pattern of being across the back, just like a board, like a plank, right across either the thoracolumbar junction right there or across the sacroiliac junction right there.
Right, and it also can cause a pain that seems like it's heart pain, also abdominal pain, nausea, and vomiting. So that's interesting, right? All those symptoms.
Yeah.
So if it's short or dysfunctional, it can't shorten or lengthen, or it can't do its job, then it could have trigger points. If it's painful, it could have trigger points that could be causing that.
Oh, yeah.
So there's a lot of other things it could cause too. So if it was just, now that's the two ends of the muscle, but the in the middle, okay, these are the six pack, these are these inscriptions. So between the inscriptions, there's McBurney's Point here, and McBurney's Point, and also the section below it, it could cause a lot of trouble here. Do you think you could read that, Justin?
I might be able to read this here. Let's see. Piriformis pain. No, I can't probably read that.
Okay, so the thing is this is called. You could have a lot of pain right here and all the way down, and could even have penis pain right from this. So you could have really thigh pain right here and down through here, and it can activate the iliacus. So it could activate the iliacus part of the psoas.
Yeah.
And so in addition to causing considerable pain throughout the upper region here and through here. So that right there, you can see it there, and it's just so this one here lower would cause the low back pain, but here it can cause a lot of other pain and dysfunction. Also diarrhea right here. So I was going to point that out, that even if you have diarrhea, if you look here for painful taut bands, you might be able to help a person with diarrhea as well. Another area.
So up here we had more of the origin and insertion spots.
Correct. Right. Super.
Where it
Yes.
attaches onto the ribs up here and attaches onto the pubic bone here. That's what gives you these, across the back pain.
Right.
And then in the belly of the muscle near these little inscriptions, we get pain there. But you'll check the whole muscle with your palpation skills, of course.
Yeah, we're looking for taut bands all through. So we're really
Yeah.
going to spend some time looking for taut bands in the rectus abdominis,
Yeah.
externus, internus, and transverse. So here you can see that you can have really bad, painful cramps from menstrual cramps from the abdominal muscles. So if we have really painful abdominal muscles, so suppose throughout the month, you could feel, oh, these muscles are really painful.
Yeah.
And then if you fixed it and it wasn't painful, then when you got the hormone changes, they wouldn't activate. So you could treat them at the time of activation when it's hurting, using heat, trigger point work, and looking for the painful taut bands. Also, you could treat it throughout the month, and then you wouldn't have the trouble at that time. Also, you've got the little piramidis muscle that you use to contract the linea alba first, and it can cause pain all the way down through here into the scrotum and throughout there. So it can go from the umbilicus all the way down and to the pelvic floor and so forth.
So you want to do a real good palpation up and down there.
Yeah.
Men, though we don't experience the abdominal, you know, it gives us something to do with our female partners when they're having their difficult
It's something you
time.
can help them with. Yeah,
we actually can be helpful.
We can be helpful.
For once.
Right. So I just wanted you to look at this one thing.
Okay.
So we're going to look at this muscle first, but I wanted to keep in mind that the parts that cause the referred pain are usually about halfway between the inscription and the attachment. So it's like in here, about right there. So just keep in mind that the referred pain usually comes from at the neuromuscular juncture, or the juncture where the nerve comes to the muscle, and that's about right here in the middle. So here you see the six-pack. So right in the halfway between the inscriptions, that's usually where the referral will be. But I think we want to get every one of these.
Sure.
We want to go through here. We're going to use a lot of pincer compression, and we're going to go through here, and we're going to get all these taut bands to actually work.
Yeah. Good.
Okay, so let's do a couple of
Range of motion test.
Yeah, let's do it. Yeah. So here's our protocol 17 that you can pick up. Where can they get it, Justin?
They can download it on our website, myopain.com, and just go to the Bodyworkers Master course page, and there you can click and download any of the protocols.
Great. So this shows you, you can print it, and you can also give it to your patients and show some really good stretches for the muscles we're going to treat today. Okay, so let's take a look at some tests for the abdominals. Let's go ahead and let's look at the test on the poster. Let's come over here.
There we go.
Oh, there it is.
So 17, it says right here, 29 and 30. And if you have your charts, you'd go to 29 and 30. Sorry. It's the sit-back test and the abdominal tension holding the legs up test. Okay, those are the two.
So let's take a few things off the table here. Oh, also we're going to look at nerve roots T5 through T12.
Oh yeah.
That'd be good too.
Yep.
Oh, I wanted to tell you about a little story. Quick story.
Oh, anecdote.
So it was at the American Academy of Pain Management conference, and I was helping with one of the booths for the well wave. And every doctor that came along said they had low back pain. You know, if you're standing around almost, I said, well, how about if we just treated your abdominals? Do you think your back pain? Go, no. And every single one, their back pain all went away.
Nice.
So it's so common. So definitely let's take a look at that. So we're going to look at the first test. So let's have you go ahead and lay down on the table. And take this pillow off here.
So we know the rectus
You're going to sit
abdominis.
up for a minute. You're going to sit up. You're going to
Does
do the
that
sit-back
sit-up?
test.
Yeah.
So you're just going to go ahead and sit back. So you're going to put your arms out in front of you, and you're going to go back slowly, vertebrae by vertebrae. Tuck your chin in, and see if you can go back slowly. Pass.
That's a pass.
That's good. So that's a really nice minimum. Then we could also do just a slightly harder test. So let's go ahead and bend your knees. And this is let's go ahead. We'll do the cheater sit up a little bit. Okay, so let use your arms. Okay, come on up and sit up. Great. Okay, and then go ahead and go back again. Okay, great. She can do it. Okay, so then the minimum fitness test would be this one here. So go ahead and see if you can lift yourself up. Oh, that was a little harder. Okay, so you passed the range of motion test, but you're a little teensy bit weak on the strength test. So the one thing that we can do for you is see if we couldn't make it a little stronger.
So what we're highlighting here is that the abdominals, well, when they're tight, they tend to cause a forward posture. They pull the neck muscles down. They pull the abdomen and chest and shoulders forward. The yank can pull the whole top of the body down.
Right.
But in terms of testing, this common muscle is very commonly weak when it ever has a trigger point in it.
That's right.
The muscles are painful when they contract, so less of the bundles fire, and the muscle tends to be weaker than it needs to be.
Right.
So these tests are kind of like strength tests.
Right, so let's just look at the abdominal tension test. So go ahead and lay back again. So you did those really well. Okay, so we're just going to hold it here. Go ahead and hold your legs up for a minute. Okay, and try to keep your back. One more thing. Let's try to keep your back flat on the table. Okay, go ahead and hold them up. Okay, relax. Okay,
Yeah,
so look, just put it down. Okay, so your psoas. So showing your psoas is dysfunctional. There. Okay, so anyway, we found a little bit dysfunction in the abdominals and a little dysfunction in the psoas. So we'll have to take a look at the psoas.
So what should they be looking for in that test?
Oh, the psoas should be able to. So she's missing the strength test for the psoas.
Okay.
So let's go ahead and let's put it up. I'll put it up a little higher so she can get her back. So what you want to do is get your back flat. So everybody. So if you just put your fingers underneath so you can feel your back is flat, right?
Okay.
So now when I let go, you should be able to hold them with your back flat for a count of 10. Okay. Okay. So I can feel she almost can't do it, but 1,000. No.
Oh,
You're not supposed to wince. No wincing. Okay. It's Mona Lisa face. You have to have a Mona Lisa face.
Mona
Okay.
Lisa face.
Let the leg down. Let down. Relax. Let me let him down for you. Okay. Let go. Let me do it. Okay. Okay. So for her, it'd be great to make her a little stronger, and the abdominals and the psoas. That'd be great. Okay. So let's also check an interesting range of motion standing up. So this was laying down, but I'd like to look at something really important. Okay.
Okay.
Which is the standing and seated one.
Okay.
So let's have you roll to one side and get up, and let's put your feet over the side, and let's have you stand up. Okay. So this is really important. Okay. So many people, their abdominals are pulling them forward like that because they sit and they're all the time, and their abdominals grow in the position that they're sitting in. Mm-hmm. So then their head gets like this, okay, and then they sort of tip the pelvis under, go under, more, yeah, like that, yeah, yeah, and this could be younger people. Now I had a 12-year-old that came in like this, and this was because her mother said that she had been in a carrier a lot, one of those little carriers.
Sure.
And then her PT at the time recommended that she give her tummy time. In other words,
yeah.
So people can have shortening of the abdominals from using computer like this, sitting like this, and also even from starting a little baby in one of those carriers. Okay, so what could we do? So today I thought we would use a really, really great technique. Okay, this is pincer compression.
Okay.
So one way to evaluate it and treat it is to come in here and feel the rectus abdominis right here, and you can feel it right there attaching right onto to the lower ribs there and onto the xiphoid there, and you could hold onto it. Now, how painful is that?
It's pretty painful.
So you could press a little lighter then, right?
Yeah.
Okay, so just go. How about like that?
It's fine.
Okay, so I can feel some significant taut bands here, but when I push or extend her back, the abdominals I can feel are pulling her forward. Okay, so that's what you want to look for in everybody. Are the abdominals pulling her forward? Now, all these different fibers cause all different kinds of problems, especially different spots. The higher up ones tend to make you think you have heart pain, indigestion. Some of the middle ones are making you feel like you're going to throw up and vomit, and some of the lower ones they cause lower back pain, and also menstrual cramps, and so all these. So you want to get the whole muscle working. Okay, you get right next to the linea alba, right next to the sixth part of the six pack that goes up and down in the middle.
The lower ones are also related with diarrhea too, right?
Yes, that's right. Yeah.
Yeah.
So you want to come like that. So then also, so I did this side, and then we could go go ahead and have you take a look at the other side. So everybody,
Yeah.
you could practice trying it on somebody else, and you practice trying it on yourself. So you tell me what you think. Now you go ahead on this side, sort of lean forward, and let's look at the contribution of that muscle to pulling you forward. And so then the person has to keep treating everything here, always over again. But it's all because we have this over pulling from the abdominals.
Wait. Say that again. So people repeatedly need treatment
All through
in
here.
these
All through here. All
through
through
the
here.
low back
Everywhere,
and
everywhere
mid back,
through here.
all through the back.
Because
Everybody's always knotted up and
their
tight,
neck,
all
their neck.
here, their neck,
neck's
shoulders,
killing them, TMJ, headaches.
and it keeps coming back, right?
And that's because these muscles here are growing in the shortened position. So let's look at how they look. So just let's finish. I'll let you do that side again, but I'm going to show you. You could even start seated.
Yeah.
So, but see, when you're seated, a lot of times she took the correct posture. She did a beautiful job of taking a very beautiful posture. But many people instantaneously, when they sit down, they do this, but what you want to do is grab a hold of it and come back like that, okay? You can do it in the seated position. Go ahead, you try it, yeah. Okay?
So what Sharon is saying is this is really the major test.
Yes.
And it's not even on these charts. Sometimes
it's
Sharon's
not.
best tests aren't on the chart.
That is true.
So this is the major test.
That's true.
Overweight and big bellies, you may not be able to pinch if there's so much tissue there, but you can get around the sides with your hands.
Well, you can find little sections
Yeah.
and start to work with it, but take it a little off the stretch.
Yeah.
So you have to take it off
Yeah.
the stretch and get it so where it's not so tense. Yeah.
Or you might even use two hands if you need to grab hold of muscle. I mean, someone really big, you do have to get around that.
So how's it
abdominal
sitting
tissue
down
limit.
treating it? What do you think, Camille? How's it sitting down?
It's painful on one spot.
Okay, so you found some spots that were painful, but
Right,
not the
and
whole
others
thing.
that aren't.
Yeah.
Right.
What do you think?
It's pretty painful on the
She's-
right side for some reason.
Yeah. So she's so
Yeah,
now the
my upper
abdominals.
right also.
They could pull this if it's one-sided dysfunction. If it's more on the right, it could be pulling you to the right and forward.
Uh-huh.
Okay, so you
Yeah.
could be uneven for that reason. Also, it could be making your pelvis come under, so it could make your pelvic tilt go backwards. Lower in the back and higher in the front. So it could make so it's making the chest, the pubic bone come closer to the ribs, like. So, but I see this all the time coming in from all over Chicago.
Yeah.
So it's a big part of what's going on.
Yeah, I know I say this all the time, but this is what distinguishes you from being successful in your practice and eliminating things or just temporarily relieving things. I mean, let's say you do a beautiful job on someone's neck, shoulders, back, mid-back, low back. Do a beautiful job. You spend a good hour on it, and then, within a couple of days, it's all coming back, and the next week you have to do it all over again. It's because a lot of things that you're missing, perpetuating factors and stuff like this. So a perpetuating factor for low back pain, you could say, is abdominal trigger points, and
Right.
hardly anybody looks at them.
No, and it's so important.
Yeah.
And remember all the things that they can cause.
Yeah.
All the things that can make you think you have cardiac pain.
Oh yeah.
It can make you think you have something wrong with your viscera.
Appendicitis.
It makes you think you have appendicitis. It makes
Yeah.
you think you have, something wrong with your colon. It
Yeah.
makes you think you have something wrong with your bladder. It makes you
Yeah.
think you have something. It makes you think you have all kinds of problems. But even without pressing in, so that's the reason I showed that technique of the pincing.
Yes.
Because maybe you're not sure if you want to go in and treat the viscera. So if you're not sure about that, say for instance, you could pick it up instead of press in.
Yeah.
So that'd be
Yeah.
very conservative.
Yeah.
So
So it
that's-
is conservative, sure.
So that'd be a conservative way of dealing with it. But I also like to press in. So I'm just saying both ways are good, But still a good way and a way that you can do it yourself is you can do a pretty good job. So what do you think of doing it laying down? Is it the same painful?
It's more painful.
Okay, so let's find a way of making. Let's do something that makes it less painful.
Okay. Yeah. Yeah. There's plenty, guys. There's plenty of room in anybody's abdomen for the viscera to move around and things. You don't have to be concerned that you're going to hurt anything. I mean, if somebody had a severe ruptured case of appendicitis, they're not going to be coming to you. It's not. They're going to be in severe pain, sweating, feverish, all sorts of things. So you're going to be, you should feel a lot more confident working in the abdomen.
Well, I love to treat all around the viscera.
Yeah.
I love to treat all the fascia and everything, so I think it's really great to do. Yeah. So that's so true. So here, could we have that Tervel book? Let's look at we'll look at the Tervel book. We'll look at things. So let's take a look at the muscle. You can see here we are, and you can see how it's attaching onto the ribs, onto the xiphoid, and also down to the pubis, and you can see where we are. Okay.
Yep.
So here we're gonna do like light work. So just make it nice and light and relaxing kind of thing. So this is good. So you could. I remember in a course I took in 1972, I think it was. They called this like hands-on anesthesia.
Yeah.
So when you do this, you can also look around for all the taut bands, and you can see where does it feel the hardest, and where does it feel the tautest. So you can it's a good use of your time to do this like light anesthesia type technique where you're just taking away some of the painfulness. Now, what makes things less painful? You could use heat.
Heat, yeah.
Cold.
Yeah.
Light sensation, deep sensation, and also scratching. So different kinds of so they're all good. Yes, brushing can all go to the brain faster than the pain message. And then while we're doing that, then we can go back and do some of the trigger point where fine taut bands, and then treat them a little bit. And then we could also do the I think they called it glove anesthesia. That was it.
We just had a question. Should you go clockwise? When you're doing deep tissue work, it is best the colon goes up like this, an upside down U shape. If you're going deep, it is good to keep your motions in a clockwise. But this superficial work that she's doing for the rectus abdominis, remember the rectus abdominis is only, this high. It doesn't go deep, and so you don't. The reason that you do deep work in a clockwise fashion, or you're told to, although it probably isn't as big of a deal as they emphasize, it's just because the colon, everything flows that way in the colon. From down, bottom left, bottom right, up, over, and then down to the sigmoid part in the bottom left. But this you can do anything that Sharon will feel the plane of adhesion, and she'll work the muscle. Sometimes it's a twisting plane to undo it. Sometimes you need to twist or turn. Sometimes you need to push in. Sometimes you move up, down, back or forth.
Less.
Well, not as bad on the left side this time.
The right was tight.
Which is odd.
I found a few taut bands there, but anyway, that's not so painful.
Yeah.
Okay, so let's look over here. So we're looking for taut bands. There's one there. So what do you think of that spot? I just want to know if it's less painful.
Well, yeah, I mean, less painful than before.
Yes. Good. So we gave it a little anesthesia. See.
Yeah, it's
So here-
worth reducing those pains, because every one of those pain nerves that's screaming into the central nervous
Yes,
system.
it could ramp up.
Yeah.
The pain. So you don't want to ramp up their central sensitization.
Yeah.
So you're trying to you want them to be less painful is better. But you also you have to go through some pain a lot of times to get to where you want to go.
Oh yeah.
So it's a combination of both.
Yeah. But when there's a pain nerve screaming, screaming in your central nervous system, and
But
you don't even
tighten up
realize
everywhere.
it. Yeah.
Right.
It affects everything along that nerve distribution, including the organs, including the joints, everything. So it's really good. You can treat the whole body from just the fascia.
Okay, so here we're going to treat the rectus abdominis as it's attaching onto the pubis, and we're going to press into and towards the attachment onto the pubis. So pubic bone. So what do you think of that?
So it's not bad.
That's not bad. I could see I knew she was going to say that.
Good.
I could feel it because it felt so. Okay, so as the therapist, when you go in and you just it goes in like butter. You figure, then that's diagnostic showing. Oh, there's no trigger point there. So, but over here, I feel the little taut band.
Yeah.
And then with my elbow, I feel it right there, and so I don't press in quite as hard because I can feel. Oh, that's got a taut band. So usually, as I feel the tension, I stop, and then as I'm holding it and it gets less tense, I go in a little bit more. and breathing and relaxing myself at the same time as I'm hoping that they're going to be encouraging them. Okay, so here we're coming across. So we're coming right here. So this would be where the pyramids would be. Okay, so right there. Okay, so just touch it lightly. Okay,
Yeah.
There we go. There we go. So breathing and relaxing. So I'm not going to press too hard there because she noticed that it was pretty painful. So this is just desensitizing it a little bit.
So the rest of the week, guys, you can just, when you've got someone on their back and you're working their neck or their thighs, just add a few minutes on the abdomen. Do a little palpation, see what you find, and you might be amazed before you get to the back what a difference it makes in the back.
Or their hand or shoulder pain, or their neck pain. Yeah, everything. Yeah, totally. Yeah. So let's just look at the lower just for a second. So we'll just take a little look at it. So we had a girl that came in who was about 12 from across the street over at Children's Hospital. And she had what they called regional pain syndrome. And part of the syndrome was these abdominal muscles that I was talking about. And it was from being in this compressed position since she's been born.
Yeah.
Like this. Yeah.
School, everything. Yeah.
Right. But then by the time it gets to regional pain syndrome, then all the nerve roots are all activated, and she had a lot of other muscles. But we did treat, and we immediately got rid of it.
Yeah.
It was it was, but we needed to look at it for about 2 months. But I meant, immediately we got her to the point where
she wasn't screaming.
She wasn't screaming.
Yeah, because she was screaming originally.
For 2 months, 2.5 months, 24 hours a day.
Yeah, she was screaming. It was ruining her whole life.
Yeah. So okay, so that feels a little better. Now the other point that this one here is the one that goes across the mid back here. This one here is the one that goes across the sacroiliac joint and the upper ilium and low back. So here we're going to go to the upper part. So what do you think of this part?
No pain.
Good. So these we a little bit there. Yeah. So a little bit there. And a little bit here. So I feel a little taut band right here. So I'm going to just stretch it a little bit. So here it's pulling your shoulder.
Yeah,
Keep in mind, it's pulling your shoulder forward. So when I push your shoulder down, the abdominal trigger points come out. Okay. Oh, look at, they don't want to contract either. So here, I can feel it didn't want to stretch. It didn't want to contract. So I'm encouraging it lightly. So I'm giving it a light treatment, encouraging it to contract and stretch. So what do you think of that light treatment? What do you think? How light is it?
It's pretty light.
Good. Yeah, I thought she'd say so. So because I can feel she's not tightening up under my hand. So it's looking really good. So these here would help to get rid of pain right here. But you want them to both be able to stretch, and you want them to be able to contract this part of the abdominals here. So we're encouraging it. Let's do it on this side. Again, if this is pulling you forward this way, it's going to pull your shoulder, right?
Oh, yeah.
So if I pull her shoulder back, then the bands that are pulling it forward will stick out.
Yeah.
Yeah. So I'm going to get right on those bands that are pulling forward, but lightly, okay? We'll do it lightly. Yeah. How's the lightliness of that?
It's light. Very light.
Good. Oh. Okay, let's also feel if it shortens. No, didn't want to shorten. So I can feel it doesn't want to do its job. So here I'm going to encourage it. Good. Now it wants to go back. So I can see right away that it's improving. So I can see it's not to myself. I'm always happy when things improve.
Yeah.
I can feel it's improving.
Yeah.
So I go, oh, that's so exciting.
Yeah.
It is exciting.
Yeah.
Okay, so then I would examine the whole abdominals for little taut bands that might be bothering her.
Mm-hmm.
Then again, I'd be looking at, do they contract? So I could each section of them. I'm seeing, does that contract? And it does. This part here isn't, right there. How does that feel right here? That she notices that right next to the linea elbow. I'm using really light pressure, but sometimes it hurts right, right there on the little attachment. So it's attached. So the rectus abdominis attaches right there on the linea elbow. So that's attachment pain.
Yeah.
Right on the linea, on the like the tendon that goes up and down the center of the rectus.
Yep.
Good there. So we'll give it a little massage. So it makes it less painful. Or we could use heat. That'd be nice. Oh, what was that?
Do you want heat?
Oh, could we have heat? Yes. Oh, you're going to help me. Thank you. Let's use a little heat. Oh, I was going to show you something really cute to do with the heat. Okay, wonderful. So here we get some nice heat. So look at this. So this is a Omatech bag. What do you think? Is it? But not too warm. Yeah, it feels good, right? It should be. You should be able to put your arm on it like this before you put it on the patient. It should be not so hot that they can't. But you could actually work through. You could feel through the water, and to go right through this. So this has been real effective many times. I could go right through the hot water.
Yeah, that's great.
And treating just like this.
Yeah, that's great.
So this would go where it was painful and difficult to treat before. You might go ahead, but maybe it's nice to treat with your hands first so you can see what you're trying to accomplish. But then maybe later you might go ahead either before and after put the heat on.
Yeah.
So I'm just feeling through so what does it feel like going through that? Now the heat.
It's not painful.
So it's not painful.
How about that?
So the heat really does reduce that pain.
Yeah.
That's good.
So this could be a great way to treat the abdominals, right?
Yeah.
Less painful, right?
Yes.
So just take our time. So this would be a good way to get the lower abdominals. You got this on top.
Yep.
And we're going to go through. This would help with diarrhea. Would help with cramps.
Menstrual pain. Yep.
And plus, this is maybe the most ideal hot water bottle for.
Oh yeah.
that. This might be the best one for that.
Yeah. There are very few hot water heat devices that you can work through. So.
Yeah, this is very good. Yeah.
That's great.
You can't do it through the hydrocollator packs. Not
Yeah.
at all.
Oh, difficult. It'd be difficult. So this is kind of nice. It's a nice thing. So everyone could get. So this is again. So this is treating the abdominals.
Yep.
Okay. So then let's think about the oblique abdominals. And
Okay.
the transverse.
Okay. Yeah.
And the so let's take a look at having you lay sideways, and we'll do a little test on those. Okay. Okay. So let's go ahead and.
Yeah, and someone said they're very easy to travel with. Oh yeah, those compress down into nothing.
Well, just like carrying a plastic
yeah,
baggie.
yeah, it's
Right.
like
Yeah.
carrying nothing.
Well, they said that the plastic came out of the race, the race with the Russians. It's a space race.
Oh, really?
Oh,
Yeah, so it's a space age double layer of plastic that holds the heat in enough that it stays hot for at least an hour, and then it's warm for another several hours. But it's so easy to work with. You can 300 pounds can stand under or more. So.
and it can protect you from the vacuum of space.
I don't think Dwayne is an astronaut.
Okay, let's have you turn sideways. We'll just put a little pillow under your head. Turn sideways.
So we've got another one.
We're
So
gonna do a little test.
we looked at the rectus abdominis, and now we've got the obliques and the transversus.
Yeah, so we're gonna just take a look at. So we're gonna go ahead and hold her. Let's put your hand here. We're gonna hold her hip here, and then take her shoulder back. You see, she doesn't want to go back. So that's showing that we have tension. So she's not passing that test here. So that's all. So we're gonna let's measure from the acromion here and down to the shoulder, down to the table. So that's 7 inches on the right. So we want to get all the intercostals to stretch, and also the abdominals.
So say again what you're doing. You're getting the pelvis straight up and down.
Yep.
Yeah, straight up
So
and down.
this here. So
Yeah.
so if you want, let's go ahead and look at it on the chart here too. So let's look at the test.
Okay,
So-
so guys, you would look at that number 17, and then you've got. There it is, number 27.
So here it is. And so you can see you're going to put one hand on the greater trochanter, and then you're going to take the shoulder. This is a pass. The shoulder comes down to the table.
See,
Okay.
yep, full trunk rotation.
And
Shoulder goes all the way down to the table.
The most likely one is what? Which one?
Most likely one is the quadratus lumborum, actually, which we did
Yeah,
last
we
time.
did.
Abdominal obliques.
Right.
Ooh, and serratus anterior affects the upper portion of the twist,
Right.
and so do the pecs.
Right. So this is she's got some tension there. So we minus 7 inches there.
So minus 7 inches that she didn't. She's off the. You can see off the off there, off the table. So she's not twisting well.
Right.
You need to twist and shout more.
That's right.
Okay, let's turn you over on the other side. And we'll go ahead and measure that side. So again, we're going to put one on the greater trochanter, and then we're going to push the shoulder back. You can see, so we're going to measure from the acromion to the table. You can see there's a couple inches there.
Yeah, not twisting well on this side either.
Yeah. So here, so we're going to measure from there to there. How many inches is that, Justin?
Well, it looks to be 6.5.
Yeah. Okay.
6.5.
So, so that's a good test. Another really great test is the anterior serratus test that I like a lot. So you put the person in, and then you put one hand here, and then you put the shoulder down, and this tests the pecs and the anterior serratus.
Right.
So you can, and again, you're trying to get it to be past the spine.
So that takes the abdominal oblique out of the picture.
Yeah. Yeah.
But when we're looking for the
Yeah.
abdominal oblique, we're
That's right,
looking for
that's
this
right, correct.
trunk rotation.
That's
like
right.
this.
That's correct. Mm-hmm. So we're looking at that, right? And also gets our QL that we're going to treat today too. Okay, so let's see if we can improve that. So a lot of times I like to treat people in the position that to get them to pass the test, because we want to pass the test, right?
Yes.
Yes, we want to pass the test. So we see what's holding us in the position.
Yeah.
So a lot of times I like to look at that. So let's take a look at one way of treating the obliques is to the external obliques is to treat it while we're stretching it. It's like this. So what do you think of that? So I can feel, so here I can feel taut bands all through here, not allowing her to move back. Okay, so I can feel it right there, right here, so you can feel taut bands here. How's that feel, the light touch there?
It's fine.
Yeah. So here, if I just put a little weight on the shoulder, you could see, and I'm not using a lot of pressure, but I can feel, so what I'm doing is I'm touching and then going down, and when I feel the resistance, I'm stopping. Okay? And then I'm looking, can I get the shoulder down more? So I'm always saying, can I get her to pass the test? So I'm looking around. So I'm looking around, where is the taut band that's going to allow her shoulder to go back? Oh, that one's coming along there. That one seems to be coming along. So here we're treating the oblique. Now this one has an interesting pain pattern. It goes, so the oblique causes pain all down through here, and into but maybe you'd like to take a look at a picture of it over there. So it causes pain all the way into the groin, right there. Here, I'll show you here. Let me help you find it. Okay. So here it is, external abdominal obliques. Causes pain all the way into where the psoas attaches and the iliacus. So that's our abdominal oblique. Or all testicle pain, or sometimes pelvic floor, activation of pain. Okay, so here we're looking. Oh, we're coming along. We're finding taut bands. So we're looking again for bands that we're not allowing her to come this direction. So we're looking, treating. Oh, there's some right there. Okay, that one's more painful. So we're looking for the taut spots that are more painful, and we're just going to hold them medium, medium amount. And then so another thing we could do is treat them with the heat on them. Let's do it. Let's try it. So we'll make it a little less painful. So it's nice to see what we're doing, and nice to feel what it feels like. But then you could also treat it while you're. But I can feel a lot more without the. Yeah. But I mean, if I know what I'm trying to do, maybe then I can just try it with the heat for a little bit. Okay.
Right after you find the spot,
That's
then you
right.
could add the heat.
Yeah, that's it.
And go right to it.
That's it. That's right, Camille. That's right. Yeah. Yeah. Where do you feel the referral from that one? Just where I'm touching?
Yes.
Yeah. So it's just right where I'm touching. So it's not a referral, just like attachment pain on the rib there. Okay.
This is going down more.
Mm-hmm. So you can see her shoulders going.
is down.
Going way down. So we're getting some of the, so there's more areas that the chest to treat too, but intercostals, but we're looking at the oblique abdominals contribution, okay? And then I'm going to short them a little bit, okay? So that's pretty good. So let's get you a little bit more like this. Good. Okay, so we're holding so the test is holding the grater here, okay? So we weren't doing that a second ago. So here, let's have you, I'm gonna just take it through range of motion. I'm gonna shorten the obliques, then I'm gonna lengthen them, and I'm gonna shorten them, and I'm gonna lengthen them. I'm gonna look, does it shorten? Does it lengthen? How does it feel when I'm doing this?
It was good.
So it feels kind of good. So in a way, it feels good to do it while you're moving it. So it's one kind of a nice feeling, yeah. Yeah. So movement goes to the brain faster than the pain message. So see, that's one way you can get through some painful areas sometimes, is to do it while you're moving it, okay? Okay, so here we'll pull this way. Okay, push your shoulder towards me, push, and then relax. And push, and relax. Good. Okay, so let's see how we're doing. So we're doing pretty good. So now we just have a few inches. So I always, if we get 50% improvement, that's really good. That's what we got there. But we probably if we treat the pecs, it'll go a little more there. Yeah. Okay. So so let's do just a teensy bit and see what happens there. Oh yeah. So here's the taut band right here. Yeah. Yeah, right there. So a lot of times when I'm treating with my fingers, I have one finger doing the work, but I have another finger or another finger kind of helping. So it keeps the one finger from, and then I don't use the thumb all the time. And then the thumb's really happy and is ready to do its job when I want it to work. You know? So I use the fingers and the thumb, but not overuse the thumb. And the elbow, of course. Okay, so let's just see how we did. So let's bring the greater trochanter forward. Okay, what do you think? Push up with your shoulder and sort of, yeah, good. Okay, good, that's better. And lift up like with the obliques, okay? So lift up with this part.
Oh.
Like do this, okay? And then come back that way. And lift up with the oblique. Yeah, good. Okay, let's feel you again, do it. Yes! Oh my gosh, that's incredible. Wow, she's incredible. Okay, so she's doing it. Okay, so you did it. Oh my gosh. Okay. Okay, so let's have you turn over on the other side. Wow. Okay, so you sort of see what I do. I find the range of motion test that they can't do, and then I try to get them to do it, right? So we're gonna see on this. Oh, look at this side. See, it doesn't want to go. Look, it doesn't want to go. Okay, so I'll get her nice and comfortable. Okay, and let's see if we can fix that. All right, so let's go ahead. Let's look for what taut bands that we have might be causing her not to be in the oblique abdominals here. So we'll look around. Okay, how about there? Yeah. Okay, so we're gonna pull the shoulder back. Remember, that's our test. And we're gonna look for taut bands. And let's take this down a little bit so that we can get the lower part here to stretch a little bit. Okay. Good. Okay, let's bend that again. Okay, let's bring your forward and then back. So we're all ready. If we measure, I will see that, here's my measuring tape. If we measure now, you can see that she's really close to the table. So now she's 3 inches from the table, right there. So that's good. So, so that's really good. So super great.
Yeah.
And so we'll do a little teensy bit of the pec on this side too. Okay?
Yeah.
Okay, she says yes. Okay, so we're gonna do that.
From 7 to 3. Yeah.
Now look at this myofascial pitting. You see when the pit, so that came back pretty fast, but you can see that if you have myofascial pitting like that, that's not from edema, that's from the muscle sitting there and doing nothing, you know. So it shows that it has a little bit of that. But I always like that because it's always something we can fix. Right there, I can feel that, yeah. So this is her, so right there I can feel her intercostals turn to bone. dystonia of the intercostal. Okay, let's fix that. I can feel that's stopping her. So the intercostals also help with rotation too. You know, isn't that great?
Yeah.
Yeah. So sometimes they stop you from rotating back like this too. Okay, so we did pretty good. So let's go ahead and resist again. So go ahead and pull that shoulder up, and then relax. And then next time let's use the obliques and do the same thing. So go ahead and pull up. Yeah, and down. Yeah, pull up from here. Yeah, they're good. And pull up. Good. And pull up. Great. Okay. Oh, you noticed that.
Where was that spot?
Right here.
Oh, okay. The obliques.
Mhm.
Yes.
Yeah, so the pincer compression is a really good way, and also you can just also move the whole abdominals around, and that's a good way of getting everything to loosen up as
That's very good movement.
well. Really good. It's looking good. Oh, it's looking good. Okay, so this part's really nice, and this part here is not quite as nice, so we're just going to go over that just a hair more. Great. So we're pushing the greater trochanter forward and the shoulder back. Go ahead and push your shoulder forward and relax. And now let's use the obliques to come on up. Come. Oh, good. And relax. And one more time. Great. Okay. So again, that causes that referred pain down through here. So that's your obliques. Yeah. And we also were treating the transverse right there as well. So internal, external, transverse. So let's look at another muscle that's real important, the QL. Okay, this test.
And what does QL stand for?
Oh, quadratus lumborum.
Yes.
So let's look at a nice picture of the quadratus lumborum over here. Let's look at a nice. Now it does cause. We're going to do this next week, because we're going to do a sciatica next week. Remember, we're doing 18.
Right.
So this is. But look, it also causes pain right here in the abdominals.
Can you get that?
Oh, sorry. Oh, I'll get it. Oh, good. So there it is, right there in the abdominals.
I was getting it
Okay.
there.
So next week we'll also be treating it because it causes hip pain as well. So one test for it is the same test we just did. Okay. Okay. So that's one, and then another really good test for it is the standing side bend test. So let's go ahead and do that. So why don't you go ahead and just put your feet over the side for a second. Use your hands. Then when you're ready, go ahead and get up. And let's have you stand up. So how do you feel?
A lot better, actually.
Good. Okay, good. So she feels better. That's good. So it feels like you can use that part of your body more.
Yeah.
Yeah.
See.
So you can feels like you can twist better.
Yes.
So that's one of our really good range of motion exercises for this area, right?
Yes.
Twisting. Yeah. That's really good. Yeah. So we're going to twist over here. She says it'd be easier for her to take.
I'll give her a better shot. Get a better shot. Okay.
And if you go up a little higher, it gets a little different. And then you go down a little lower, it gets a little different. Okay, so let's do the side bend test. So let's come on over here. Let's stand here with your knees bent a little bit. Okay, great. Okay, let's go ahead and we're going to measure your middle finger down to the floor. So, but no, this time we're not doing it forward, just sideways. So side bend. So you're just going to go straight sideways, and don't bend the knee though.
Oh.
That's good. That's a good example. So then we're going to measure, and you should be able to come down to the knee. She comes below the knee, so at least she has generally good range of motion on the other QL on the other side. So 15.5 inches. Let's do. So we want them to be the same. We want both sides to be the same. Okay, and then you go and make sure they're not bending forward when they do this test. Yeah. Okay, so and again, you should be able to get it down to the knee, which she is. So she's pretty good. And it's 15.5.
She's equal.
Well, maybe 15.75.
Oh.
So it's pretty much even on the two sides. Okay, so we're going to treat the QL a couple different ways, and a good way to treat it is using the body support system. So we could do that. Also, you could treat it yourself. But let's see. Oh, how much more time do we have?
7 minutes.
So
in this section.
Okay, let's look over here at the like it. So the first muscle we treated was the rectus abdominis and the obliques. Okay. And we also treated the transverse at the same time. Then the least likely one here is the quadratus lumborum, causing the pain in the abdominal area. So we're going to treat that one next. We did the little test for it. Okay, so let's take a look at that. Okay, so I also like to feel it a little bit before. So I just like to feel how the muscle works. So if you could bring your pelvis under, let me feel your pelvis go under. Now feel it go back and under, and cough. Let me feel you cough. How's that feel? Feels okay?
Okay.
Okay, let me just feel you wag your hips. Let me feel you wag them.
Side to side.
Yeah, how's this feel right here?
Ah.
Okay,
Oh.
so I can find the parts that aren't working. I found one part that's not working. Okay, then I just like to feel you now extend back towards me with your back. No, come this way.
The other way?
Yeah. Okay, I just
I
want to go
can't see with
forward.
your arm there, honey.
Okay, go forward. No, okay.
Oh, wait.
No, go like this, and then go like that. Get relax. Let me just put your hand over here. Okay.
Okay, that's
okay.
good.
Okay, so I just want to feel bend your knees, and now you're just going to make your torso go forward, and I'll make your torso go back. And torso forward, and torso back, and torso forward. Okay, so then I'm also going to look at the iliocostalis now. So let's look at the picture of the iliocostalis. I'll do it because of the tallness.
Yes. Oh, I couldn't reach that.
So here's the iliocostalis right on the ribs here, and you can right here, right there in the ribs, and you can see it causes pain in the front. Isn't that another one that causes pain in the front? So we see that this one causes pain in the front, and also this one that we're going to look at next causes pain in the front. So we've got the front ones causing pain in the back, and the back ones causing pain in the front. What about this? Okay. Okay, so let's go ahead. We're going to feel. So for this, I like them to anchor their hips right on the table. And then I like to feel the iliocostalis doing its job. So then I like to feel, so we're going to feel it. So I can see if it's doing its job. How's that feel?
Feels okay.
Feels good?
Yeah.
Mm-hmm.
Oh, there I can feel that.
Mm-hmm, right there, yeah. Okay, so most of it's good on that side, but there's a couple spots. So let's look on this side. So it attaches here. It's like a C4 through C7 in here, and then so here, and it also attaches here onto the ilium. So I'm looking at it. So we're stretching it this way, and looking at it as we're doing that. So we're taking a look at the muscle, and we're seeing if it. Oh, what do you think of that? Oh, she's got some. Okay, I found some taut bands here. Okay, right on this side. Okay, all right. So we know what to treat now. Okay, so we have some. So I found some taut bands and trigger points over here, on the right here. So we found there, and we found a few in the iliocostalis. So we're going to treat those. So let's treat the QL first. Okay. Okay. So I'm going to use the body support system. Great. And let's use a little hot water. So give me a little hot water here. I'll get it. Good, thank you. So we'll just put a little hot water on the other side, so it just keeps you warm a little bit. It distracts you a little bit while I'm doing the other side.
Distractions are always good.
Let me lower the table down a little bit. So how do you feel so far?
Better.
Good. So, so is anyone out there treating themselves or treating somebody else like I am? Is anyone pairing up and treating their partner? Any response?
Not yet.
Okay. So remember, and also remember, this ends up on YouTube later, and you can always go back and look at it later. Okay. Okay. Let's have you lay sideways. Oh, 2 minutes?
Yeah.
Okay. So we'll look at both sides for a second.
Okay.
Okay, so let's go ahead and lay on your side. So this is what we're going to do. So this is what everyone should do. Should set up for so you can put a pillow here, and make sure that you have a pillow under their neck. So you can have a really soft one like this, or a little nice round one like this, under their neck like that. And then we're going to treat them like this. Stretch this way, like this. I'm going to treat the fibers that go this way, and then we're also going to. And the QL, the quadratus lumborum, and then we're also going to come like this and treat some of the fibers that go a little bit more like that. So we'll get them in different ways. Okay, so let's see you back in 10 minutes then.
39.
Yeah. Yeah, it looked good. I don't know why the screen looks different, but it shows up fine. You see all this is on there? That normally is not on there.
Yeah, that writing. I was wondering, that's not
just a-
showing up on the screen.
Nah, that's what I went to make
That
sure.
was kind of weird. I was going to ask you
I
about
went to
that.
make sure, and it's not showing up on the screen. I don't know why
It's never been there before.
It's never been there before. Oh, it's a new thing.
Because normally it was tiny.
Yeah.
Yeah, I was wondering if that was showing up.
Yeah.
Yeah,
No,
it's good that
it
it's
doesn't
not.
look like it's not. It doesn't look like it's showing
Good,
up.
good, good. Are there any pictures in here you want to find before we get started
Let's
again?
pull them out. Yeah. Got it right here. Okay, so we got some nice pictures. Like that. Okay, so here's the balance now. And here, look, so these are really good too. Okay, so look at those. So we're going to do keep on. It's 30. It's 30.
Okay, good. Open here and open there. Okay, did you want to show me at the beginning?
Yeah.
Okay. Open there. All right, cool.
She's gonna dance. Good. That's good. Oh, she's good. She's good. She's good.
It'd be better since this new update. It does show this thing on the screen.
Oh,
It's not too bad,
oh, it does. Okay.
but maybe I'll keep the titles shorter in the future, so it doesn't take up as much space. I don't think it shows these total viewers though, so yeah, it must just be a new update. But it made me think that it had stopped, you know?
Sure.
Because that's what it usually says when it's done, you know?
Yeah. Yes.
So,
Correct.
yeah, it looked like I'd stopped, you know? Yeah, so that's why I had to check to see if it was still going. 4-letter word. Back up. Doot, doot.
So we're going to take a look at the QL treatment. And we're going to do the neocostalis, and also we're going to do the multivity.
Okay.
Okay. So we're going to do those. So
Which
those
is
are
very
the,
similar to the super sensitive spinal segments anyway, right?
oh yes. Oh yes. Oh yeah. Oh yeah. Oh yeah. Same thing anyway. Right. Same thing anyway. We're just gonna, but we're gonna point out just how that we have the QO causes the abdominal, the neocostalis causes the abdominal,
Oh yeah.
and the multivity
Oh yeah.
refers the abdominal. Okay? So just pointing that out first, okay?
Yeah.
We'll talk about next time. And then do you want to talk about pain-free Tuesdays? Oh, okay, we're not doing that yet. Okay, we'll wait. Okay. We'll wait till we post them.
So we've been doing practitioner treatment,
And we did self-care.
and we've done self-care too.
Yeah, we did, but not all the self-care.
Got all self-care.
Yeah.
Okay, cool.
We'll do more we're gonna do some self-care as soon as we finish with these few months, then we'll do some self-care, okay?
Yeah,
And then we'll do range of motion,
yeah,
I think.
yeah. We could like, as if you had a patient, and walk them through a quick routine of pain key 17 or something, you know?
Yeah.
Yeah. You can do it like that too. You can always present the information as if you just saw the patient. They're now going out of time, and you're giving them protocol 17. And you highlight and draw it. And it's good for them to see how you're drawing it. How you highlight, you know. It's good for them to watch you do that. Highlight and Okay. All you crazy myofascial cats, it's time to start again.
That's it. Hi there. So we're doing abdominal pain. This is our protocol 17, and this is broadcast number is it 13? 14. No,
14.
No, 13. 15.
Well, pick one of those numbers.
Yeah, broadcast 15. Yeah.
Broadcast
Okay,
15.
okay, so
yeah.
broadcast 15.
Protocol 17.
Oh, this whole time
Yeah.
I've had it as 14. All right,
Oh.
this is. All right, this.
Oh, no.
Oh, that's it. Start over. Just kidding.
Okay, so here we're going to take a look at the QL again. Remember, the QL then causes pain in the abdominal area and can cause pain down into the groin and down into the testicles and so forth as well. So that's another one that could bother us. Another over here again.
Another
We've got
back muscle causing abdominal
this is
pain.
the iliocostalis, and it causes pain across and into the abdominals and into the chest here. So you can see that it can cause a lot of trouble in the front, again, into the abdominals. And another one we're going to look at for supersensitive spinal segments, and because it causes pain in the abdominal area, we're going to look at these multifides along the spine. You see how they attach here on the spinous process, and then over here to transverse, near the transverse process, and then onto the body of the vertebrae there. And let's, where did we put the referred pain pattern?
When you're dissecting
There
the
it is.
spine, those are very, very
Here's
thick
the referred
muscles
pain
along
pattern.
there.
So here's your referred pain pattern to the front.
Yeah.
So this is
So
your
yeah. What does it look like on the back again?
this is your
So they-
multifides. So this
yeah,
is your
so-
muscles, the little muscles along the spine.
Yeah.
They cause pain along the spine as well.
Yeah.
Okay.
But then in the
But they,
front too.
but then they cause pain here in the front, right
There you
here.
go.
But in addition to that, they can cause nerve compression, slight nerve compression or major nerve compression, which can cause you to have supersensitive spinal segments. So we can test for those using skin rolling and other really great techniques. We'll do more than skin rolling on one of our classes, but skin
Okay.
rolling is a great one.
Yeah, yeah. Simple,
So
easy.
it is easy. It's one of the easiest, fastest ones. Okay, so let's take a look at the QL. Okay, we measured, and she was even on both sides, but we're just going to go ahead and look at all the abdominal obliques and the QL with her laying sideways. So go ahead and lay sideways. Put your shoulder in here. So this is a great way to treat it. So you're going to sort of attaches onto the ilium and then onto the ribs. So you can pull the ribs and the ilium apart. And then you can look around for taut bands, and you can find some. So you say, oh, you find some taut bands. So first I can feel some taut bands in the obliques here. So I feel that right there. What do you think of that spot?
Yeah, I can feel that.
Yeah. So we're seeing what's not allowing the stretch. But the QL, to find the QL, you want to go straight sideways. So remember, it's here to the 12th rib and to the ilium there, and it's kind of like a knife edge right there. So we want to look right here. So let's go ahead. We're going to use our elbow, and you're going to come in. You're going to breathe. So have them breathe, and as they're exhaling, so as you're inhaling and they're exhaling, you're going to press in, and then you're going to notice look for the resistance, look for that knife edge. Then you're going to pull get just anterior to the QL and press in and pull it back, and then you're going to feel that knife edge, get behind it, and you're going to push right on it and pull forward.
So she's, not just compressing down, but she's giving some, other direction in her compression too. So backward and forward.
So usually
helps
what I
break
do
up
is,
the adhesions.
yeah, so I like to press in, and then I go slightly towards the attachment, slightly towards where I feel the dysfunction. So I'm giving it a little bit of movement as I'm pressing in.
Yeah.
But not a lot of movement. If you give it a lot of movement, it tenses up.
Yeah.
So you want to go just the right amount that makes sure that it loosens up.
As a person on the table, when she's doing that, when she's switching the plane of pressure, it really is amazing. Sometimes you feel the muscle just untwist like a knot, and it'll release.
So we can also use a pincer compression. Oh, I guess not.
Could be a little ticklish, right?
Okay, so we'll go slowly. So here, this is on the obliques. So if you want to get the obliques and the external obliques, the internal obliques, and the transverse, you can get it really good in this position. So you can do the pincer and you can move it around.
So leg off there again. See that?
Come this way.
See that? Hands like that.
So this is getting it really good. So I feel some taut bands right here. Yes, I'm just going to go back. So I looked around, and I'm going back and treating the ones that are dysfunctional.
Yeah.
So just going to hold it, breathe, and relax.
So do you guys kind of see the general idea here? Is we want full range of motion. So we put them on the stretch, then feel for the bands of muscle that are not allowing that stretch to take place. Those are going to be the tight ones. And then work on those in the position that we want them to be able to achieve. And then as they improve on that, the next band of muscle that's resisting comes up, and we work on them until they're all gone and the patient can pass the range of motion test.
Okay, let's have you use this muscle here so they come up this way. Yeah, and then down. Let me feel that. And down. And come up. Good. And down. Great. Let me see one more time over here. Good. She's doing it. It's working.
Good.
Okay, great. So we're just going a little bit different position.
Sharon, what are you feeling for when she's doing the
I
contraction?
want to make sure the muscle's actually working.
So you're feeling for spots that are spongy that are not contracting?
Yeah, that aren't contracting, yeah.
Yeah.
Or that's so hard, really, really hard, and you can feel it's not contracting because it's so hard, or doesn't, or one reason or another isn't contracting.
Yeah.
Yeah. So I'm looking to get it all the tissue to stretch and contract if I can.
Yeah.
Hip hike, like the hip. So just this come up and down. Yeah. Up and down. Yeah. So I'm looking at QL.
Yep. QL. Yeah.
Let's see if it. Just making sure she can hip hike. Okay. So I still feel a little bit right here. So this is the abdominal oblique.
So you felt a taut band?
Yes, right there.
Right there?
Yes.
That wasn't relaxing during the
That's right.
contraction?
Yes, sir.
Yes, sir.
Okay, so I'm going to just go ahead and shorten it and lengthen and shorten. Good. Okay, so that did a pretty good job on our QL there, and also got our internal, external,
oblique,
and transverse. So that's nice. So let's go ahead and look at the iliocostalis in this position. So let's go ahead and take a look at it. Remember, it attaches up here onto our cervical vertebrae, and starts over here. So it's come like this and attaches onto our costals. Okay, so here are ribs. So I'm going to grab a hold of it, and I'm going to make it a little longer there. What do you think of that?
Okay.
Remember, this causes pain in the front, right here, right through here, and it could cause some pain that you feel you really think there's something wrong with your internal cavity. There's something you think you've got a burst appendix or burst colon, or you think you got. It can make you feel like you really got something wrong with you.
Yeah.
So you're going in and then
Yeah,
medial
so I'm
toward
grabbing.
the spine.
So I'm grabbing it and pulling it.
So
Giving
they
it a
know
little-
which direction you're going.
Are you going to show a picture of it? It's a couple page ahead there. Oh, that's not a very good picture.
Well, the referred pain.
Look, pull out the
In the front
drawing.
like
Pull
this.
our drawing. She's going to show you our drawing. No, you've had it in your hand. No. In the protocol, 17. Look.
Oh, on the protocol.
That's there.
Right. Here we go.
There's the muscle right there.
Okay, so
And this is the referred pain that can be so painful right in the front, right there. Okay.
so we're also going to take a look at the multifidi. So remember, these multifidi here in the lumbar refer to the abdominals. So this is important. So I'm just going to take them, rotate them a little bit. I'm treating those little multifidis, shortening them and lengthening them.
Yep. They rotate, so you got to get that rotation in there. If you're treating the multifidi without encouraging the rotation, then you're not, re-educating the muscle to do its job.
So I can feel some bands right there. Yeah, she agrees. Okay. So I'm just going to go right there. So when you can find the bands that don't do the job, you can go ahead and treat those. So one indicator you got trigger points is that it doesn't do its job.
Yeah.
Doesn't stretch, doesn't contract.
Yeah, yeah.
Painful when you press on it.
Especially for a muscle that's real long like that, because I mean, it's a muscle group that's very long. You know, you've got to get every single segment of the spine has got to work independently, properly.
Okay. Let's take a look at you on the other side. This time on the other side, why don't we train you to treat those muscles this time? Okay.
Yeah, how would you treat these muscles yourself?
How would we do it? Yeah,
How would we do it? I
Okay,
mean,
so let's try. So suppose you're at home. You could go ahead and treat yourself using the band hammer. So So here, let's go ahead. Let's have you reach underneath and see if you can reach your QL in this position. So I'm going to show. So this is the QL muscle. Okay. Cardialis lumborum, right here. So you can see how it's attaching onto the vertebrae, onto your rib, and down to your pelvis there. So what do you think? Can you get it this way? So let's maybe take these pillows out. So let's see. We'll just have you lay sideways, okay? We have too many things. They're getting in your way. Okay, so go ahead and lay sideways. Okay, so see if you can get on your QL sideways like that. What do you think?
Oh, yep.
Yeah, so she found it, yeah. So this is a really great way. You can see that she's pressing in with the end of the tool into her QL right here. And then she can get further back here, but the QL would be right there. Okay. Yeah. So but you could just put the right amount of pressure that you want. And again, if you could lay on the hot water bottle and do it that way too. So suppose it was painful. So we could put the hot water bottle there too. So go ahead and lift up for a second. Okay, so we can have that there. Okay, put it down. And then you can get in there like that. What do you think of the hot water?
A lot better.
Oh, see? Listen to that. Okay, so you can just lay on that hot water and you don't hardly feel the pain of the pressing in, right? You feel it a little bit, but it doesn't hurt so much, right? Yeah. So you can get all through there and treat your QL. Yes?
Yes.
Yeah. Great. So what about treating some of the abdominals? So let's go a little further back and get the abdominal attachments here. What do you think of that? And let's come more, you go ahead, you can take a look. So you're getting further back. And then we're going to come more forward. Let's come forward and like get right into the abdominals there. So what do you think over here?
Oh, yeah.
So she's getting under the ribs a little bit there, right?
yeah.
Yes.
So she's using the tool all through this region. Oh, here's my pillow. So when you're laying on your bed, it's good to have a nice pillow holding your head up nice, like this. Well, yeah. So you could take up the space between the shoulder and the floor or the bed and put a nice round pillow underneath your neck is really one good method.
Yeah.
Okay, you like it so far? Okay, great. So what about treating the rest of the abdominals? How might we do that? Okay, so we could go ahead. Is this a good tool? Is it too big?
Oh, that's fun. I
Think?
Yeah.
So you could use it that way? So we can go ahead and look at all through the abdominals. So what are you looking for? You're looking for taut bands and hard spots, painful spots, where muscle attaches onto the bone. You're looking for good. Okay, so she's treating this side like I was treating. So you're looking, and also you can look more on the obliques over here. So do you think this is a pretty good way of doing this side?
Yes.
Yeah, it's nice. You're so relaxed, right?
Yeah.
It's not too painful because you got the hot water bottle there. And this is a nice tool. You can also use other handheld tools you might like to use. Let's try this little tool.
Oh yeah,
So
hand
go
over
ahead.
hand.
So
That's
you could use a little
yeah.
tool like that. What do you think of that?
Might be easier.
Oh,
This is easier?
it's a little easier, you feel?
Yeah.
Okay, good. So it's
Since you're
good.
not using your own.
Okay,
cup.
good. Okay, so she's finding this way easier. So here, she's using the tool and working all over here in the abdominals. Yeah. Great. So,
Would that also work for the obliques and the QL, or not mostly?
yes, you could do the
You could.
QL, but you'd have to get, like, you roll this way, and then you put the tool there, and then you could roll onto it. like that.
Yeah.
What do you think?
I see, yeah.
See, so you can roll onto it, but
Yeah.
just to the amount that you feel good about.
Yeah.
So it's a good tool. You know, it's a good all-round tool.
Can they do it seated too, or is it?
Oh yes, oh yes. But let's look at it on the
Okay.
wall, because on the wall is the best.
On the wall is
is
the best.
really really good.
Yeah.
So this is really good. This is so relaxed.
Yeah.
You could be, you know, so you're really doing a nice job. But let's also look at how we
Yeah.
could do the iliocostalis and how these areas could be done on the wall.
Yeah.
Okay, let's go ahead. You sit up, and then
Swing your legs off there. Sit up.
mhm.
Yeah, perfect.
and how might you do it seated? Just go ahead and sit up for a second. He was just suggesting seated. So here you could come with your tool. And you could come, you know, kind of like treat yourself like this. You
Yeah.
come forward like that, you know, in the seated position. So you could look around like this.
I bet you some of you
Mhm.
can already see why the wall is going to be useful,
Right? Yeah. So go ahead and put your feet right on there.
because it's not an easy place to get with your hands. It's like
Mhm.
right where your hands don't reach, right there.
Mm-hmm.
That's where you've got to get some compression.
Mm-hmm. And then you could come and shorten it and lengthen it. Mm-hmm.
Oh.
And look around. Mm-hmm. So this is a good, you know, this is one movement while you're treating yourself is often good. Yeah. So you can put that down, and you can choose the other hand. So we could treat the abdominals like you did here with the jackknobber. So sometimes I'd like to draw the jackknobber. Then I said, you know, point out that we could treat, you know, in different areas that we could treat with it. Okay, and then again here I might say we could treat with the jack there, and also here. So, or you know, we could show how we're going to use another tool. Okay, so we're going to do this treatment for the iliocostalis here. Look through here. So we're going to take a look at top bands here, and we're going to do like a ball on the wall. Ball on the wall. Okay, and then here we did the big back knobber lying down.
So this is how you use those protocol, sheets, packets. You print them out, then you highlight, and you draw in a little bit of a personalized instruction for them, so that they feel that it is, relates to them.
And we could highlight the little spots. Sometimes it's nice too. You know. So you did the little areas we're going to treat. Remember, this area here refers to the front. This area here refers to the front. This area here refers to the front. So we're going to be treating all those areas on the wall. Okay, let's give it a try. We'll do it together. So let's take this and let's have a nice ball. Let's have a nice ball. So you take, let's have 2 sizes of balls. And I'll get some balls.
And these were bought at 5 and Below or something? Or?
Yeah, I think we might have got those at 5 and Below. Yeah, we did. I think we did. Okay, so let's take a look at the iliocostalis, and we'll do this on the wall. So should we try this wall right here?
Yeah, this wall would be good.
Let's try it. Yeah. Okay, so I'm gonna assist you. So let's start with this ball here. This one here. Okay, so let's go ahead and put the iliocostalis on the stretch. Okay, we're gonna put it right on the wall right here, and so like turn a little more sideways. So we're gonna feel it. So it's about right there, and lean like away from it. Yeah. Okay, now go side to side. Now look for a taut band. What do you think?
Right there.
Okay, then you're going to press your body onto it. Okay, and then you can let your arm rest. So you don't have to hold it the whole time. Yeah. Okay, now let's go ahead and move around. So I'm going to take a look with another ball. I'll do it next to you. I'll do it on this side of you here. Okay, so let's take a look at you're doing your left iliocostalis. So I'm going to do mine. So I can feel it right there stretching. So I'm going to get right on its attachment onto the ilium. So I'm going to go ahead and look for a taut band. If it's not there, then I'm going to come up a little higher. And I'm going to stretch it right. Oh, I can feel I'm right on it. I'm right on it. So I'm stretching it. I can feel it go over. Oh, I'm right on it. So I'm going to hold it, breathe, and relax. Found a little tight spot on it there. So we go ahead and get right it, breathe and relax. Let's go up a little higher. Let's look for that taut bands right there. So when you go a little bit over it, you can feel the taut band jump up a little bit. So often when I'm treating it, I like to go up and down. Oh, look at that beautiful sunset, Justin, over there on the building. Oh, pretty color. Okay, so another really great way to get your QL would be to use a ball about this size. You can put this right on your waist, right here on the side. So again, I'll do my side over here. Okay, so we're going to get right on our waist. So the smaller the ball, the more pointed it is, and the larger the ball, the less pointed. So if you don't want it to be as painful, use a bigger ball. And if you want to get more pointed right on right on one taut band, you can go like this and get right on the band. So you're looking for a taut band, a painful spot that hurts when you press it. Go ahead and breathe and relax once you get onto a taut band and painful spot.
Now, patients oftentimes don't have these tools sitting around, so you should have some, in stock or a good place where they can order them, and you get them familiar with using the tool in the office, and then they just walk out with it. You don't have to worry about selling it to them. They're already using it.
So true.
Yeah.
Okay, so for those of us that have a practice, usually you could 15% of your practice could be just tools, but it's important that people have tools.
Yeah.
But it's also an income generator for you potentially.
Mm-hmm.
Okay, so let's take a look at treating the abdominals. So let's go ahead and put the abdominals on the wall. Okay, and let's look at let's put it really low because we're gonna get right on the one that causes the pain across the back.
Okay.
And then we're gonna come up, and get the ones that cause the different abdominal pain, menstrual cramps, also vomiting, and bloatedness, the feeling of bloated. So let's start right above the pubic bone. Okay. So can you see what we're doing, Justin?
I'm getting a pretty good shot.
Okay, good. Okay, so we're gonna go ahead, look right above the pubic, go to one corner, breathe and relax, and look for a painful spot, and lean back if you can, and you're gonna stretch right from the pubis. So you're gonna go ahead and stretch right from the pubis.
Yeah, exactly.
Okay, but then now we're gonna go up from there, and some of these now begin to cause you to have pain throughout the abdominal cavity. Okay, so let's look go straight on the center, right on the linea elbow, right on the middle part of the part that has the six-pack. Go right on it, go just to the side of it, and look for some taut bands in the abdominals. What do you think? You found any? You found some? Okay, when you find one, you're going to press on it, breathe and relax. Let's go up a little higher. And let's look for some taut bands in that rectus abdominis. And let's come up a little higher.
This is good work for hernia prevention too.
Oh, it's so great because if you're not going to pull the abdominals away from where the inguinal ligament is there, if it's not so tight.
Yeah.
Right. So if it's not so tight, then it's not going to pull away from its attachments.
Yeah.
Yeah. Or pull apart in the middle. Yeah.
So if someone has ever had a history of hernia or anything, this would be so important for them to do.
Underneath the rib cage. So get underneath there, get right underneath, and look for some taut bands there. What do you think, Emil? Any taut bands underneath?
On the right. Same as Stephanie. We had some on the right higher.
Okay, so what do you think of that treatment? Could work?
Did you guys
what about the obliques? We could treat that a little bit. So if we can get a little bit more here, let's see if we can get the abdominal obliques. Remember, this causes pain right into the groin, and men, it could get into the testicles. It could cause you to have quite a bit of anterior pain in the right where the iliopsoas is.
the oblique on
Oh
here.
yeah, go show its preferred pain.
That's the external abdominal oblique, and
It's good.
there's the
She's
rectus abdominis.
good. She's good.
Right. So all these pain areas. And then here's the iliopsoas. So you can see how those are kind of similar right there in the front.
It's really good.
So what about, can you repeat that question? I just missed that.
What's the question?
Someone asked a question, but it faded real
Oh,
fast.
it did it too fast. We didn't miss it. Tell us the question again.
Yeah. Repeat that question if you can,
Repeat
please.
that question again. Yeah.
Foam roller on the floor?
Oh
Yeah.
no, foam roller isn't good for this. Because,
No?
no, because you really need to have something round to fit in here. The foam roller, okay. The foam
Maybe
roller
for the QL, right?
for the QL.
Yeah, just
would
for
be
the
good for the
QL.
QL. Yeah.
Right.
And through here, but even for the QL, it's not as good as the ball. Yeah. But it's good, but not as good. But for the abdominals, you need a ball.
Yeah.
Now this would be beginner's treatment, and also just treatment when you're standing, anytime.
Yeah.
So but also you could go a little deeper by laying on a bed or the floor. The floor,
Yeah.
of course.
Why don't we show that? Do you think we should
Could we show that?
Yeah.
Who would like to show that? Okay, so should we do it on the table? Let's try it on the table. So let's do the abdominals on the table. We did that a little bit last time. Let's go ahead and let's have you lay on your tummy.
This is actually my favorite because I like to have a little space to do yoga, and I like that area of the floor to be cleared, and there's a little mat on the
Wasn't
floor.
that nice?
I generally like to do my self-care in that space. That's my preferred. If I was going to do anywhere,
So nice.
I
yeah.
like to be on the floor. If I can do something on the floor, that's even better.
Okay, so let's roll to one side a little bit. So one way to start would be to roll to one side, get it underneath the ribs there, and you're gonna get right onto the. So what do you think of that treatment? So that's good. This is one way of treating it, but it's not treating it on the stretch. It's treating it when it's a little slightly shortened.
Yes.
So next we're gonna treat it a little bit on the stretch. So here, another way to treat it too is to have somebody else treat you. Help. So your daughter or son or your significant other could press. Okay, and you could come in like that, and that's treating your abdominals that way. Another way, let's do it on the other side. Okay, let's come up like the Sphinx on your elbows. Okay, so and then here you're going to get it underneath, and they're going to press on it while you're stretching it. Okay, that's too painful. That's too painful.
Yeah.
Yeah. So for her, that ball is a little hard. So
Do you want a larger one?
yeah, let's try the larger one because it'll be less painful.
Yeah, and someone made the good point that not everyone has an easy time getting up and off the floor if they're in severe acute
yes.
pain.
So this would be like, it's nice to do it laying in bed.
Yeah.
So you could also modify it a little bit by using pillows and stuff. So again, you could, kind of, they put like a pillow here and kind of, spend, you could kind of put, so you could spend some, time doing it without working quite as much.
Yeah. And
Okay.
and you can do this stuff on the wall too. So
Yeah. Oh yeah.
like she was saying. you
And
know?
then as it becomes less and less painful, you could do it right on the floor.
Right.
Yeah.
So then you can
Yeah.
say, "Oh, good!
Okay.
Look, now you're able
We're
to
not
do it
gonna
on the
make you do
floor.
it.
Congratulations!"
Okay.
Okay, go ahead.
You having a
Turn
workout
sideways,
there?
So what do you think of the bigger ball?
It's less pressure.
Yes, less pressure. So the bigger ball. So this is like a children's basketball, like maybe. So this is like but also you could take some. Oh, somebody filled these up really hard.
Oh, you could
Yeah. So we could take some of the air out. Yeah,
Yes.
yeah. So and also we can also use for fibro patients or patients with a lot of pain. We could use a really soft ball. So sometimes we use a super soft ball that just squishes. So you can start that way if it's painful, and then eventually get up to where you could use it. So and then do the wall, and then to the bed, and then do the floor.
So would you say abdominals is just something that you should check on every patient? Is that
Yes. It's important because it's going to make such a difference on it's a really and also QL is a big underlying perpetuating factor.
Yeah.
So the QL could do what? It could make you go this way.
Yeah.
Or it could bring your hip up that way.
Yeah.
So the QL also the abdominals again could bring your pelvis forward like this.
Yeah.
And then people could, as soon as they sit, they go like this.
Yeah.
Right?
Yep.
Yeah. And then when they stand, they're kind of still doing that, you know. So they're trying to get out. They get formed into the seated position.
Yeah.
The abdominals, psoas, everything gets formed like that. Yeah. So we're going to do some range of motion exercises. But we're going to, before we do, we have one more muscle. We're going to do the multifides. We have one more. Remember? Okay. So we're going to do the multifides. Let's do that on the wall. Oh, let's do it on the table first, because you're on the table. Then we'll do it on the wall. Okay. So let's have you lay on your back.
And this is something you can call up patients that haven't seen you in a while, and you can say, hey, you know, I'm getting trained in this new this Bodyworkers Mastercourse where they're teaching me like PhD level body work, and I just got trained in how important it is to treat the abdominals, and it's something I overlooked in your care before. I really would like to show you what I've learned. I think could be very helpful to you. So as you learn new things, you can contact patients that you haven't worked with in a while and let them know that you have new skills.
The lumbar area, especially. So we're going to do all the lumbar multifidi, a little bit of the sacrum.
Yeah.
So let's go up to T12, L1. Okay. Yeah. So now she's going to put she's going to find her spine, come just to the left of it. Then she's going to press her back down onto it, and then she's just going to lightly press it this way. So right. Lightly press. How does that feel when you lightly press?
You're welcome.
Good.
Yeah. Good.
Okay, now she's going to lift up a little bit. She's going to move it down. So she's going to feel the spinous process, feel the transverse, get in between, get a little groove, press her tummy down, her back down onto it. Then she's going to use her tool and come that way. Right? Yeah. So we're looking for multifides that are so tight that they could they're painful, and they could also be causing super sensitive spinal segments and heightened tone in their muscle their nerve distribution.
Yeah.
Okay, good. So we did that. Okay, so what's another way of doing it? So let's continue. We'll do it another way. Let's do it on the wall. So turn to one side. Go ahead and sit up.
Yeah, I was gonna say. So whereas I like the abdominals on the floor, I like this on the wall. I love to lean my back against a tool against the wall. That's my favorite position.
It is good, isn't it?
Yep, I love it.
Okay, so let's go ahead and let's do this. So let's go ahead and do the little multifides right on the wall. Yeah, go ahead and use yours. Yeah. So we're going to find this spinous process goes just to the side of it. And let's go to the right side of it. And we're going to go and we're going to feel it and put our tool right onto it. Let's go up and down, and let's go side to side. Let's get in that little groove and see if we can find a painful spot. Not painful. Let's move on to the next spot. Okay. Let's go up and down, side to side. So while you're doing it, I'll just show. So we're starting here, and we're going up and down, side to side. Go here, 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 and then down to there, a little bit over the sacrum.
Yeah.
Okay.
Yeah, I just love that.
How's that feel?
Okay.
Now another really good one is you can use little tiny super balls. So this is nice because it's a little. See, this one's a little soft.
Yep.
So that's nice, but if you don't want it to be too painful.
This is a good
But
one,
then
too.
this is nice. It's a nice
It's a little
tension.
bit soft, yeah.
It's a little bit soft. You can squeeze on it. This one's a little harder. So, but they're
Oh,
all
this
no.
one's
They have little differences, but there's also you can get a really tiny one, like a super ball, like this, and you can get right along the spine, and that's a good one too.
Yeah.
So a hard super ball, go right along the spine. Yeah. Okay, what do you think of the right along the spine?
I'm using this one.
Oh, that one's good. It
That
has
one's
some little
great.
knobbies on it.
This guy.
Oh yeah, that guy has.
Yeah,
the
this
This
little
guy
knobbies there.
feels great.
Okay, so what's a really good test for this muscle that we're looking at right now?
This you can do watching TV, guys. I mean, this is you get down, do your abdomen on the floor, and then do your ball on the wall while you're watching whatever shows you like. What was your question?
Oh, well, it's okay. So one test for all the paraspinals is touching our toes.
Yes.
So let's see, after we treated ourselves and we did everything, is it easy for you to touch your toes? And go ahead and can you also, and see you, let's go ahead and touch your toes. Yep, she does that nicely. And come up vertebrae by vertebrae. And you notice if there's any flat spots. And I just noticed there was this flat spot right here. So another test was the seated test. Go ahead, sit down.
Right.
And this is you're going to look for. So go ahead and bend vertebrae by vertebrae, and see if there's. Go put your hands between your knees. Okay. And go vertebrae by vertebrae. Look for any flat spots.
Go down as far as you can go there.
Mhm. and then here, and look, so you can see there's some taut bands. So you can see a few taut bands right here,
Yeah, you can see some flattening.
and some flattening in some spots. Yeah. So you're looking to make that more rounder than it used to be. It's a lot more rounder than it used to be.
Yeah.
So you're looking for flattened spots and tight spots when you do that test. Great, great, great. Okay, so let's go ahead and stand up again.
So then she would go back and she'd work on those spots on the wall again, you know, doing the extension and the rounding while doing the compression.
Yeah. Well, go ahead and try that again. So we saw the little tight spots. So go ahead and look for some painful spots that we looked at there. And so I saw some right here.
Right there.
Mm-hmm. And it's good to, while you're on them, if you could kind of bend forward like that.
Yeah, exactly.
Yeah, that's better. Yeah.
Yeah, do full rounding and then do full extension of each individual segment. Yeah.
So then after treating, you could also see, do they pass the skin rolling test?
Oh yeah.
So let's try that. So let's see if she passes the skin rolling test. So here, so we're going to see, but don't have your head for the test.
By the way, skin rolling is not only a test, it's a treatment too.
It is, it is.
So it's very good for the
So
fascia
here-
of the skin.
So it's a little bit tight right there. So a little bit right at this, right over the sacrum. So we do have a few tight spots there, but it's lifting up some. But but here that's a little tight right there. Okay, that's good. Yeah, right there, and right here. So like L3. Okay, once you go ahead and try that again. So see if you can get right on that L3 multiples.
I'm having a good time here.
Yep, that's me.
This feels wonderful.
Turn on the television and sit there and do this. This is great.
Yes, we got. Isn't it wonderful to have your spine mobile?
Oh, it feels
It doesn't
awesome. Yeah.
feel really good to have
yeah.
your hips
Yeah,
and
like
your
a
spine
snake.
and everything
Oh, it
really
feels
move
great.
good. Right,
Yeah,
right. It makes you so happy.
Yeah.
Yeah, it makes me really happy.
The last thing I could ever imagine is having one of those fusion surgeries where I can't move a certain segment of my spine
But
anymore.
but the people that have the fusions always end up having pain above and below the fusion.
Sure.
They tend to,
Yeah. I just don't like the idea of my spine becoming stiff and immobile.
Okay, so let's take a look and see if at you a little bit. Let's say you stand up and put your thighs right on the table. I'm going to look at those muscles and see if what they're doing. So I'm going to see if they're doing their jobs. Okay, so I feel a little dysfunction right here, right there. Okay, let's look on this side. Remember, these would cause referred pain to the abdominals in the front.
Yeah. This is similar to the way you'd assess spinal mobility in a chiropractor.
Okay, so let's have you sit
setting
legs
as
out
well.
in front of you on the table. So also, if you don't want to do the standing toe touch, you could also do the seated toe touch. So go ahead and touch your toes seated. Okay, and so that's a pass. Okay, so let's go ahead and let's treat you a little bit while we're stretching you here. So let's look at the longissimus, and here we're going to look at the iliocostalis. So here we can see. So let's look for some taut bands on the iliocostalis.
Wow, look
You
at
can
that.
see some right there. So you can see them. So you could treat her right while she's in the stretch.
I was just about to say, you're not going in there with an elbow, are you? Wow, look at that.
Yes, she is.
Look at that. See?
She's not going to do that.
See? That right there is an expert move.
Okay, so I'm stretching it while I'm pressing on it. So the part that's restricting her range of motion, we'll see it. We'll see her increase her range when I press on.
Yep. By the time she's done, she will have moved considerably over further, just because that's what Sharon is going to make happen.
Okay, then let's look at the multiplicity, and we're going to really rotate.
Oh boy, look at that.
So she's anchored
Oh.
because her hips are here.
Wow.
So she can't move them. So this is going to stretch her multiplicity.
Wow.
Okay, what do you think of that? Yeah, right
Yeah.
there.
That's why the name of her clinic is Pain-Free Full Function, because she's going to get every degree of motion out of that joint.
Okay, so we're really going to give that multiplicity a good stretch.
And as I've mentioned, the number one input to your brain, keeping your brain plastic and young, is input. input from your just all the mechanoreceptors in your body. So if you want to keep your brain young, you want all your joints to move as much as possible. If you had 10% reduced range of motion, that's 10% reduced input to your brain. That's a lot.
So when we use it in this position here, we're also getting into all the fascia that's going all the way down to the heel.
Oh, yeah.
So, you know, the sacrotuberous ligament down to the hamstrings and down to the gastrocnemius and the heel. So in this position, we're giving a really good fascial stretch as well.
Oh, yeah.
So here, we're going to take a look at the iliocostalis, and then we'll look at the multifidus again. So here, we can see some taut bands right here. Right there. So let's take a look at them while we're stretching.
By the way, there is a name for this position.
Oh!
It's called slump. That's called. I'm not joking, it's called slump. So get in the slump position, and that's what it is. You're just completely folding your body into the greatest fascial stretch from heel to head that you can get, and that's called the slump. Yeah.
Okay, let's look a little bit more at the multifidus.
Wow, that's a workout, huh? Look at you, wow. See, there's even blood getting to her face from this. This is quite a treatment.
Mm-hmm. Okay, so I'm just getting these multifidus here to turn. You can see they didn't want to. Feel this spot doesn't want to turn.
Yeah.
Right there. Yeah, that spot doesn't want to turn.
It doesn't want to, but Sharon wants it to.
We're encouraging it.
We're encouraging it.
We're seeing if it wants to.
Deep down inside, we know that it wants to.
It wants to get better.
It just forgot how much it loves full motion.
Yeah. Okay, so we're just going to go ahead and
Look
take a
at
little
that.
bit.
Oh, I am jealous. That's it. You ever get sympathy pains working on your patient and you just see how good it is? You feel like, boy, I wish somebody was doing this to me. Wow. I can only imagine Sharon must feel every day.
Well, you know, there's a funny thing. I kind of, even though I'm treating somebody else, I actually like to relax that muscle on myself.
Oh, yeah.
So I kind of treating myself.
You give yourself a car massage.
That's it!
She's working on everybody else. She gets a little good karma going and gives herself a car massage.
That's it. Yeah, that's it. Yeah.
Oh my God.
So you're coming down. So she's coming down much better.
Yeah.
Okay, let's push your back towards me. Push and relax.
Yeah, this is a partial slump.
And relax. Okay, let's go that way and push
That's
towards
the
me
full
to the right.
slump. That's the slump right there.
And relax.
Yeah.
And push to the
yeah.
more movie. Okay, and then we'll go the other way. And go ahead and push towards the other way.
Yeah.
And relax. And push. Good.
Full slump.
Okay, so we moved everything pretty good.
Oh, wow.
Forehead to my knees.
The first time she could touch her forehead to her knees.
Yeah, that's it. Good job.
Wow, that was good then. Okay, so that was a really good way to treat the multifidus, wasn't it?
Yeah.
And also the longissimus and the iliocostalis, because we're anchoring your hips really good, and then we can give them a really good stretch, and then we can see what's stopping it from moving. Yeah.
I want to capture this. You see this look on this, you see that face? This is the face of somebody who has just gained more motion, and their brain is so happy. All sorts of, it's like seeing a relative you haven't seen in a long time. It's like when you get that motion that hasn't been there since you were, a toddler. It's like a happy reunion for your brain, and you just get all that endorphin release.
That's true. Okay, so we're going to do the cat back and the old horse here. And we're going to do this one here, this nice little stretch. And we're going to do the front stretch like this. You can do this over a ball, over a treatment table. And then we're going to do the side stretch, okay? So let's go ahead and let's do the cat back and old horse. So come on your hands and knees for a second.
Yeah,
Okay, so your hips, come your hands a little bit under your shoulders.
would you say, Sharon, to finish every treatment with them doing something?
Oh, isn't the best?
Yeah.
Oh, yeah, so it's good if it's good on the table, but then it's good if it's good when they're walking.
Yeah, yeah.
Arch your back up and now slouch it down like an angry old horse.
Yeah.
And up like an angry cat.
Always finish with them doing something to
Mhm.
themselves. It's a really
And
good
then slouch it down like
practice.
an old horse. Good. Okay, so that's good. Let's go ahead and that's our cat back and old horse. Let's go ahead and have you stand up. And we're just going to give the multifides a nice stretch, and you're going to hold them for that stretch. So we're going to have you lean over the table. And you're going to come like this. It's going to take me a second to get the table up here. Okay, go ahead. So this is it right here. And you're going to just go ahead and let your head rest there. So just resting with your over a table like this, or a treatment table. Maybe that. Like that. Okay. And just go ahead and that's stretching as well. Let's go the other way.
There you go. Rest. You deserve a rest. You did a good job.
Yep. There we go. We're stretching it, and then you could even put heat on it while you're stretching. That might be a good way too. So just put heat on it while you're stretching. And I love to treat it like this. This is my favorite ways to treat. Is in this position.
Yeah.
You get really, really good. Okay, so we did this too. Then the abdominals. Let's go ahead and do the abdominals. Let's have you sit all the way in the edge of the table.
What brand is this table? Do you know?
Oh, I'm sorry, I don't know. But let's look. Let's look.
Touch America.
That's it. Yeah.
Is it?
Oh no.
Oh.
No.
Yeah.
Okay. Well, I wouldn't. Okay, that's what I wouldn't do.
Okay.
You wouldn't do it.
Because
As a chiropractor, I wouldn't do it either.
but it was great that she felt like doing it.
Yeah, yeah.
That she wanted to do it. You know?
Yes.
But that's not what I would do a little different. Okay. Okay. So let's have you sit down here, and you're gonna sit here, but you're gonna step. You sit here, put your feet on there. Yeah. Okay. So get really close to the edge. Really, really close. Okay. So now you're gonna pull your abdominals, and you're gonna go ahead and lean back. Okay. And then we're gonna have you stretch out the legs, and then you're gonna have the arms over your head. So this is a good stretch. So then we can put a heating pad on it. Then you know.
Yeah.
Put a nice heating pad on it.
Yeah.
And then this keeps it. You know, it's a good way. So you could lay forward, stretch with a twist, lay in your back like this, and we could do this while you're with the heat on. And then one more for the QL. So let's go ahead and bend your knees. So when you're in this position, when you get up, you always bend your knees for a second, and you put your hands down, and just breathe for a second, and then you get up. Okay, now let's go sideways. Turn sideways. Let's go that way. Okay, and then this is for the QL. So you can put your foot here, put like that, hand over like that. And so here again, you could put heat right on here, and you could warm up and lengthen this area.
Can I see the leg there for a second?
Yeah.
So you got,
Mm-hmm.
there you go. She's got her leg stretched like a...
So this is when we remember we had her laying sideways before.
Yeah.
But this is now the advanced sideways.
Yeah.
So later on, when she's more stretched,
Yeah.
this would be good. The advanced way would be the right way to do it. Okay. All right.
And there's always good,
Okay.
standing
Let's go-
side
let's
bend
go-
too is good too. All that,
Oh yeah, so this would be this is long held stretches.
Yes,
Okay, so
long
then
held
this
stretches.
is short held stretches next.
Yeah.
Okay, so go ahead and stand up. So let's see if we can. So we'll put some music now. Why do we like to put music on while we do range of motion exercises?
Do you want me to do my song?
Because Sharon says so.
No.
Because Sharon says it's better.
What do you think? Why do you think we like to use?
Because there's a beat so that you can move.
Fun, yeah, fun.
Makes it more fun.
Rhythm, yeah, it's mostly
Right?
fun. That's exactly it.
Makes it more fun. Well, this is kind of slow. So that one's a little too slow. Okay, let's do this one. Okay, for this we're gonna do the pelvic tilts. This is for the QL. Okay, pelvis forward, back, forward, back, forward, back, side, 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 forward, back, forward, back. Now you're going to keep this still. Side, side. This is for your QL. QL, QL, QL. Now keep this still. Move that. QL, QL.
That's it.
Now it goes diagonal. Forward and back. Forward
Is that the obliques?
and back. Well, just for the obliques, yes.
Oh yeah, obliques.
Okay, other side. With the other foot forward. Obliques. Oblique. 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 And go all the way around.
Around the world.
Okay, good. So we're going to go ahead and go touch our knees. Knees. Knee. Touch. Touch. And come back and forward. Back. Other side.
Believe it or not, they didn't choreograph this. Case in point.
Okay, let's use the iliocostalis. Crank. Contract. Other side. Contract. 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 Side. Side. Side.
Yeah. All right, guys, keep
Okay,
up
next
your good work.
what's happening next week?
Whatever 18 is.
Okay, sciatica.
Oh,
Hip
sciatica.
pain and sciatica.
Okay, hip pain sciatica next week. All right. You guys have heard of that one, I'm sure. All right.
Okay, here we go.